Well, good afternoon and welcome everybody. My name is Damon Palmer and I'm the Head of Strategy and Population Health at Norima Healthcare Consulting. And I'm delighted that you're here this afternoon to join with us, which I'm sure will be an enlightening presentation by my colleague Steve Habermehl at spiderSilk. First of all, let me just quickly introduce you to Norima Healthcare. We're a new digital healthcare practice that has been established in the last year, and we're a global consortium of digital healthcare companies that are seeking to introduce new and innovative solutions to the challenges that the Canadian health and care system faces. Many of our digital solutions are AI-based, for example, helping to respond and address the challenges in elective surgery recovery, in population health management, supporting integrated care systems, and supporting digitally enabled ecosystems. And we're huge advocates of digital health and care, but we also recognize the threats and challenges as we pivot more towards our reliance on digital health and care. And so this presentation by spiderSilk is very timely, relevant, and current. And one of the key messages that I just wanted to quickly leave you with before Steve takes you through the presentation is something that was pointed out to me in my previous role in working in life sciences about the value of health and care data. And you might not realize it, but data such as our social insurance number is perhaps only worth around about 10 cents on the black market. Data on our credit card number might be worth less than $1. But our health and care record on the black market is worth well in excess of $250 per record. So you can see how valuable that is to those that are involved in trying to gain illegal access to this information. And so the next presentation by Steve will take you through the spiderSilk solution. And then what I will do is I'm looking forward to taking your questions at the end of the presentation. And then Steve will kindly set out how spiderSilk are offering a free complimentary service to our audience. And so without further ado, I'll hand you over to Steve, and I really hope you enjoy the presentation. Thank you.
Thank you, Damon. Ladies and gentlemen, my name is Steve Habermehl, and I handle security services for spiderSilk. What I'd like to do is kind of set the tone for this as purely being an educational overview for you and your team. The aspect that we're going to be focusing on is the external attack surface, right? And what we're looking to do is give you exposure in visibility and discovery capabilities of your external attack surface and how it plays. Christopher Wray, the FBI director, recently, as of yesterday, was speaking to the Boston at the Boston conference, where he laid out that Boston Children's, the FBI thwarted an attack on Boston Children's from Iran. And he stated in his comments that it was going to be one of the most insidious and evil attacks they've seen to date. So nothing more was given. This was an attack set back in August of last year that he was able to finally discuss now. Here's some comments from him talking about Russia and their approach, as well as, just trying to see how I can see the screen rather than myself. Okay. View gallery. So all I see, Damon, is myself. Is there, oh, I see remove spotlight. Well, are you able to see the, some people are saying they can't see the screen.
Yeah, have you got the share screen on, Steve?
For the slides?
You can do the share screen there, Steve, at the bottom.
Yeah, with that we'll share. I was hoping that the slides that we had going up. All right. So with that said, Christopher Wray was talking about the approach and what they are thwarting. What China is now doing, and Russia, is they're specifically targeting all specific critical entities, right? And what the FBI has set up is a command center now working with organizations to address this. What we want to do is we want to proactively provide Canadian healthcare an understanding of what that attack surface is. And what we do at spiderSilk is we provide complete visibility. We also provide complete discovery and understanding of your environment. And what I mean by that environment is your external attack surface, all public facing assets that are unbeknownst to you, all the domains, subdomains that are associated with those public facing assets, as well as will provide you with any active threats that are related to non-coded threats, meaning misconfigurations. Your DevOps team is pushing out a new patch or code development, and they think they're pushing it to a secure repository. What it actually is public facing. So thus you now have your potential keys to your castle exposed to any nation state, any organized crime, hacktivist, or lone wolf. Let me share with you what that looks like. And what we're doing is we go out and leveraging only your name. So there's zero setup by your team. It's 100% non-intrusive. What we'll do is you leverage your healthcare organization's name, scan it against the 4.3 billion IPs out there, pull that information back, then we'll directly and indirectly discover what assets belong to you. We'll also be able to show where they're located, what's on them, and who owns them. We're also able to give you all threat reports that will dictate, provide you with a description of the threat. We'll give you the threat intel references and steps to remediate that active threat. Here's an example of that dashboard that we will provide for you. So let me go to a redacted view for one of our customers. And what you can see here is a simple resonance dashboard that will give you, as you see here, all public facing assets, all active threats, the domains and subdomains associated to those assets. We'll also give you geographical representation of where those assets exist and reside. So you can quickly triage and say, okay, we've got 10 assets in Canada, we've got 116 in the US, we should not have 5 assets in Russia, or 24, as you see down here, in China. You're able to quickly triage and get an understanding of what those assets are, what's on them, who owns them, etc. We also provide you with information on your cyber footprint, so you're able to understand what cloud providers are out there. Our focus is on the holistic approach of known assets within your attack surface, unknown assets such as shadow IT, test and dev servers, and then third-party assets, right? MSPs, suppliers, partners. Then the most important ones are the malicious ones. Those actually doing harm or crypto mining or launching attacks against other systems. What you'll also be able to see and understand is you're able to get a complete asset with our assets directory. Now, what you're seeing here is a grid view. And what this grid view shows is any threats associated with that specific public-facing asset and what that asset looks like as well. So you can see, all right, I click on this one, and this one footer. You can also click on and see what that page looks like, right? And there's simple plus username and password, and this is public facing. Now you're able to decipher, is this and should this be public facing for our organization, or is this a potential issue we need to resolve? And we're able to provide you with that as well. This also gives you access to any threats that are associated with that. You can click right on here. And this is what I was talking about earlier, is our threat analysis team will provide you with these, this threat report, which will give you the threat details, giving a threat title, which is a leaked Firebase credential, a description, and then the actual scores of components. And if there is any type of screenshot, we'll provide that to you as well. Let me go back to the active threats. As you can see from our capabilities, is we're able to provide you with GitHub leakages, potential CVEs, which are common vulnerabilities and exploits, misconfigurations, exposed internal assets, etc. One of the things that we've really seen in the healthcare organizations are some specific ones around GitHub, right? Public exposed password hashes. So like I said, threat title will give a description of this and then actually show screenshots for you and with you. We've done this already for numerous Canadian healthcare organizations, and we've uncovered wormable Windows exploits, misconfigurations, like I'll show you a misconfiguration here. And this is purely just an exposed arbitrary file upload page, right? So we found a page that allows file uploads to one or more other pages. And then what our recommendation is, this page must either be removed or have its access restricted, so only authorized personnel can access it. And then a screenshot of that. The importance is to be proactive, because what this is, you've got everything internally with file systems, email, network, everything within the perimeter is locked down. What we want to provide Canadian healthcare organizations is a holistic view of what external and public facing is exposing your organization. So what Norima and spiderSilk are offering is all attendees on our webinar, or any organization that you may want to share this with, let them know that all we do is we utilize your organization name. There's zero setup to generate this. It's 100% non-intrusive, so that we can provide you the visibility, the threat intel on non-coded threats, misconfigurations, as well as GitHub, GitLab, and Bitbucket source code leakages. Our focus is purely on giving you that information proactively so that you could secure and shrink the number of public-facing assets, eliminating all active threats, and quickly triage your domains and subdomains to make sure that they are yours and only yours. What we also want to do is, and say this is completely complimentary, what you'll get from us is a dashboard view that you'll have access to, as well as any active threats. You'll be sent for instance, this high-level threat that we recently picked up on a lot of IP servers. You'll be given all of these threat reports as well. And like I said, the description, as well as the reference information. And when you click on the reference information, as I'll do right now, it will take you directly to that site, giving you the actual factual data on what is that threat and where it resides, right? Within our reports as well, besides the reference threat intel, we'll also give you the affected assets and their IP addresses. Like I said as well, we'll give you a CVSS score, the severity, immediate notification, because what spiderSilk does is we send email alerts. We also provide phone support to our customers, and we are REST API based, so we can integrate with your SIM, your ITSM, or any of your other solutions to completely automate it for your flow. And you'll also have screenshots of the threats as well. So with that said, Damon, would you like to take back next?
Thank you very much, Steve, for that really illuminating conversation. And so we've got a couple of minutes left for questions, if any of the audience would like to post their questions in the chat box. So what I wanted to just highlight again is how health and care record is becoming increasingly valuable, and hence the increasing risk of criminal activities, and hence the increasing risk of attack threats such as those that Steve identified. And research and surveys have shown that because maybe senior managers don't understand the value of the data and the enormous data that they are collecting within our hospital systems, they don't understand the risk and the threat of these kinds of responses, and investing in mitigating these kinds of threats. And I know from my own experience in Montreal how an attack can destabilize and really affect the operational running of a hospital for anywhere between 3 and 6 months. The cancellation and the postponement of surgeries and hospital appointments, and everything else that comes with having to cut off internet access, even telephone access, and how that can really impact on clinical activity. And also what I wanted to say is, in joining together, we invited spiderSilk, Norima invited spiderSilk to carry out some threat assessments of our clients. And I can say from first-hand experience, first of all, how quick these reports and dashboards can be generated. And as you've seen, the incredible amount of detail that these reports provide, enabling the clients to quickly and clearly address the challenges in their attack surface. So if the audience would like to sort of post any questions, perhaps Steve, I could ask you a question. If you could if you've got any examples of how, you know, the impact of where you've seen the impact of a threat with one of your clients, and then perhaps how, you know, using spiderSilk, they've managed to mitigate their threats going forward.
Of course, Damon. With some of our customers, specifically around the source code leakages or misconfigurations, because those are just a simple human error, where what we found with like healthcare ERP systems, as they're pushing out new code or updates, they believe they're pushing it to a GitHub, GitLab, or Bitbucket repository that is secure. Unbeknownst to them, it's actually a public facing one. What we were able to do in that instance is we were able to notify the healthcare organization, which was using a McKesson, and they were able to understand that what public facing repositories were out there, reduce them, so it mitigated any potential future error where they pushed it out to a public facing system, server, or asset, that they would have their McKesson ERP system open to the public, right? Other aspects that we've worked with customers on, specifically in healthcare, are on the coded threats, right? Where these attacks were ransomware, right? There, we've got two that had potential ransomware or had ransomware attacks that were looking to figure out where they occurred, and they were looking within the perimeter, right? What we did is we were able to do that external scan and give them a complete perspective on what they had and where they were looking, right? That they had no idea. The unknown assets, the known assets, the third parties is one of the critical areas where we'll be able to help you with your suppliers and your partners, because we'll be able to run assessments on them as they're because they're an extension of you and your organization. So that's an area where a lot of organizations don't think. They're thinking in the perimeter. Our emails okay, our network's okay, our file level is okay from our checks. But what we need to do, we need to understand what the external aspect is, because that's where organized crime is going. Damon, can you see the slides now that they put up?
Yes, I can. Thank you, Steve.
Okay. So this is what I was talking about, and it was very poignant with what Christopher Wray was talking about yesterday at the Boston conference. But Russian attacks, right? The key is working closely, you know, before it becomes more damaging and more destructive, right? Russia is notoriously sinister with its attacks. This is from a 60 Minutes interview on April 24th. And Christopher Wray was saying, and the prospect of that becoming more destructive and more severe is something that we're keenly watching for. We're treating it as sort of a combat tempo. We have a 24/7, like I said earlier, cyber command post running, and we've now had for several weeks. With regards to China, right, they have a bigger hacking program than that of any other major nation combined, right? It affects everything. What you need to do is understand that. And like I said, it's not just China, it's not just Russia, but it's also Iran and what they were able to thwart from an attack coming from them against Boston Children's. So once again, we're a cybersecurity software company specializing in attack surface management and threat detection. I just wanted to share with you why that matters and what that information that Norima and spiderSilk will provide you, because understanding what your attack surface looks like will allow you to focus those finite assets, resources, and time on the right cybersecurity risks. And then last slide here, this sums up what we're talking about with regards to the attack surface, right? The known assets are the ones, the servers and services and other things in cloud infrastructure, web facing apps that you're familiar with. What we'll give you is that other 75%, the shadow IT, the temp services, the third-party managed service providers, partners, and suppliers, as well as the malicious ones. So like I said, you can send us a note, and all you have to do is just let us know what your healthcare organization name is, and we'll do all the rest. 100% non-intrusive, zero setup on your behalf, maximum value with the report and dashboard. Damon, back to you.
Thank you, Steve. And it's interesting, isn't it? Because the, I'm not a specialist in cybercrime. You are the specialist. But in researching this, it's I read that the National Crime Agency are now regarding ransomware as probably the biggest area of crime in this domain, and with healthcare information becoming more valuable, and also with criminals, if you like, the skill levels to do this are becoming for criminals. It's becoming easier and easier in some aspects for them to create these kinds of attacks. One of the things that I was thinking about, Steve, was that when you talked about ransomware, how implementing a spiderSilk solution typically is something of the order of 1,000th. The cost of investing in spiderSilk is roughly of the order of 1,000th of the cost of a typical ransomware threat. So for me, the economics and the value case of investing in something like this is very clear, and prevention being better than the cure, and being somebody who's witnessed firsthand a cyber attack and going through the ransomware and seeing how a hospital can be how the operations of a hospital can be jeopardized for 3 to 6 months. Investment in something like spiderSilk is incredibly important. So, Steve, do you want to take us through just to the last page with our contact details, and then our audience will have a copy of this recording, and will have access to all of this information, including our contact details, if they want to get in touch with us and ask for more information about either spiderSilk or the services that Norima offer in the digital health and care space. Is there anything else that you want to present on the spiderSilk software solution before we move on to the complementary offer, Steve?
Not at all. I just want to let everyone know that our focus is on giving you any and all information. As Damon was saying, ransomware is one of the biggest threats we face, right? And healthcare organizations, as well as secondary and higher education, are the two verticals that are targeted the most, because it's the most impactful when you think about it with patient care and the student. So.
And have you got the slide, Steve, with the complimentary offer? Is that the next slide? You could just quickly talk.
No, whatever. AVC. Can we bring that back up? I went to the last of their slides that they had for us, Damon, and try to go back.
Okay, so unless there are any questions, and you're able to just share with the audience the exact complimentary offer that spiderSilk are offering, Steve,
Yep.
then
Okay.
we will.
Yeah, that's the last of the slide that they have for us, Damon. So I guess we'll have to verbalize it.
Yep. Do you want to go for it in the first instance, Steve, just to walk through the really comprehensive offer that you're providing, and what if people basically contact you or I, then we will get in touch with them straight away to provide this, and then they can all have access to their dashboard.
Yes. So the offer from Norima and spiderSilk is provide us with the name of your organization. There is absolutely nothing you need to do. And what we will do is provide you with the full dashboard creation, access to that dashboard. Now, this will just be point in time information, but you'll have full public facing assets, domains and subdomains, geographical representation, active threats, as well as access to all threat reports for all those active threats, giving you description, threat intel, and remediation steps from our threat analysis team. What we want to do is we want to remediate any and all external attack surface threats that your organization has. And we can get that done, like Damon said, in a relatively quick manner. 100% complimentary, and it's information that's given to you. We're not, what a lot of our healthcare customers love is we're not reverse ransomwaring you, where we have the information and we're charging you to get it. You're going to get everything and all the information you need.
And I can confirm that through our conversations and in our discussions with spiderSilk, we asked them to carry out four reviews across our own organization and 3 other clients. And I guess with for those of you that might be new to this, we don't know what we don't know. And across those 4 company reviews that spiderSilk carried out the risk assessment, they found numerous risk assessments across all 4 organizations, some of them high threats, some of them medium, some of them low, and they were able to turn that information around very rapidly, and we've shared it with our clients. But of course, as Steve said, that is just a point in time, and so actively monitoring our service attack is what is critical. So unless there are any questions from our audience, and I'm just looking in the chat, then what I will do with about 5 minutes left is to thank everybody who has joined us on our session this afternoon, and I hope you enjoy the rest of the conference, and ask that our audience now moves on to the symposium 7 to 9, which will be following closely after this session. And you have our contact details if you have any questions at all. So thank you very much on behalf of myself and Norima and Steve.
Thank you, Damon. Everyone, I hope you have a wonderful rest of your conference. We really appreciate your attendance here, and hopefully it was educational in what you can uncover, to discover, and change within your organization from an external attack surface. We look forward to hearing from you and working with you. Thank you.